Hello everyone, my name is Sam. I am a nutritionist GP. Welcome to my presentation today. Today's topic will be on cancer screening. The specific topic for today will be on prostate cancer. As usual, before I begin my presentation, I just want to show my disclaimer. First, we will take a look at what is a screening test. A screening test refers to testing an individual who has no sign or symptom of a disease in order to detect a disease early, so that the disease can be picked up and treated early before it can do any harm to the patient. Also, in order to be qualified as a screening test, the benefit of early testing or screening and detection has to outweigh any potential harm that the screening test can cause. With this in mind, we will take a look at what and where is the prostate gland. So the prostate gland is part of the male reproductive organ system. It sits just below the bladder, which is here, and is about the size of a golf ball. The prostate produces most of the fluid that makes up the semen. And the prostate fluid nourishes the sperm, keeping it alive and giving it the energy, the fuel, the energy to swim towards its destination. And this is a picture of the sperm. Next, we will discuss what is prostate cancer screening. Prostate cancer screening refers to a blood test for prostate cancer. Prostate cancer is a tumor that starts in a prostate gland, and the specific blood test is called prostate specific antigen, or PSA for short. The next question that we should ask is, should I have prostate specific antigen or PSA blood test? Before we answer this question, we need to understand a little bit about prostate cancer facts. There are many different types of prostate cancer. Most actually grow slowly and never cause harm. However, there are a few others that can spread to other parts of the body and can cause serious harm and therefore premature death. Prostate cancer is more common as you get older. It is also more common if you have at least one close blood relative with prostate cancer, for example, a father, a brother, or a son diagnosed with prostate cancer under the age of 65 years of age. Many prostate cancer are low risk, meaning that they grow so slowly that they would never cause any harm. Also, because prostate cancer is normally slow growing, elderly men who are more than 75 years old of age or with a life expectancy of less than 10 years will probably not benefit from prostate cancer screening test and treatment. Next, we will look at a few other facts about prostate cancer screening. First, there is a debate about what constitutes a normal and an abnormal PSA level when screening. Second, even if there is a reference range other than prostate cancer, increase in the PSA may be from other non-cancer causes. Thirdly, even when a patient has cancer, the PSA test does not tell the difference between those cancer that will cause harm and those cancer that will not cause harm. As a result, usually if a patient has got increased PSA after doing a screening test, a biopsy of the prostate is usually the next recommended step that is being recommended to the patient if a repeat PSA test remains high. We have to keep in mind that the act of screening and therefore subsequent further testing and further treatment for these potential prostate cancers can cause harm. And in next slides, we will take a look in more details how these cascades of events of screening, testing, and treatment can cause harm. A biopsy is a procedure in which a sample of prostatic tissues are removed for cancer testing in the laboratory. It is needed to confirm whether a prostate sample is cancerous or not. However, there are problems with this procedure. Number one, all procedures carry risk. This would include bleeding, pain, or even heart attack related to the procedure that require hospitalization. There is also a risk of trauma to the local pelvic structure or nerve that can cause future complications such as impotence, urinary incontinence, or bowel problem. Secondly, many biopsy results suggest that many elevated PSA results were actually false positive. Thirdly, there is also an overdiagnosis of prostate cancer. This means that many people with increased PSA level were found to have slow growing and otherwise harmless cancers. This can lead to problem number 4, which is overtreatment. Because of the PSA testing and therefore the subsequent biopsy, many people then undergo unnecessary treatment due to uncertainty and worry over the biopsy result. In other words, this same man would do well even without treatment. So we now come back to this same question. Should I have prostate-specific antigen or PSA blood test? This depends whether you are low risk with no symptoms or low risk with uncomplicated urinary tract symptoms, or high risk man with one or more first-degree relatives diagnosed with prostate cancer before the age of 65 years of age, or you are a high-risk man with a first-degree relative with familial breast cancer, BRCA1 or BRCA2 gene. Now let's take a look at the first category. If you are a low-risk patient with no symptoms, screening of asymptomatic and low-risk men for prostate cancer by PSA blood test is not recommended. This is because the benefits have not clearly been shown to outweigh the harms, as mentioned above. Therefore, possible harms and possible benefits must be discussed, and informed consent must be obtained when prescribing a PSA screening test to a patient who are low risk with no symptoms. It is important that patients understand the risks and benefits and limitation of the screening test. Tests can then be offered if the patient requests to have it done. The next category of patient is patient who are low risk with uncomplicated urinary tract symptoms. This would include hesitancy, straining, weak urinary stream, intermittency, post-void dribbling, and incomplete emptying. Men with uncomplicated lower urinary tract symptoms, as mentioned above, do not appear to have an increased risk of prostate cancer. Indeed, the most common cause of lower urinary tract symptoms is benign prostatic enlargement. Early prostate cancer often have not does not have any symptoms. It is therefore important that patients understand the risks and benefits and limitations of the screening test. Then the test can be offered on demand to the patient. And the third category is patients who are high risk. This would include men with one or more first-degree relatives diagnosed with prostate cancer before the age of 65, or men with a first-degree relative with a familial breast cancer history. In this same group, probably the benefit will be more than the risk. However, it is still important that the patient understand both the risk and benefits in full and the limitation of the screening test before testing can be offered on demand as well. Thank you very much for watching my YouTube video. If you like my presentation, please kindly subscribe and share. Thank you very much. Stay alive, stay safe, and stay healthy. Take care. Have a nice day.